Yeah, some of the signs and symptoms you might see with pulmonary hypertension. The first one's gonna be the heart sounds, which is a loud P2, which is the closing of the pulmonic valve, also the murmur of a tricuspid valve regurgitation. One of like the main ones you're going to see. So if you think about pulmonary hypertension, so you see it as this high pressure in the lungs. So kind of think about what's going to suffer with this high pressure. So if you think of the blood flow throughout the body, it goes from the right side to the lungs, to the left side, to the body, right? So from the body to the right side, to the lungs, to the left side, to the body. So if you have high pressures in the lungs, traffic is going to back up most likely in the beginning, right? So your right side of the heart is going to have to work harder because you have a high pressure in your lungs. So you're going to slowly have a backup and accumulation of fluid throughout the body. So your liver is going to suffer. You might now have something called portal hypertension because of so much of this backed up blood. You're going to have right-sided heart failure. You're going to have edema in your extremities because remember, everything's getting backed up before it gets to the lungs. So your whole body is going to suffer. It's not going to be an issue of the blood getting to the organs. It's the issue of blood coming back from the organs to get reoxygenated. But eventually down the line, it's going to be an issue of both blood going to the organs and blood leaving the organ. But for right now, in the beginning stages, it affects more of the right side, and you get this pooling and slowing of the blood on the right side of your body. So as it enters the heart, and that's you're going to have those main signs and symptoms.
And if you pull up an EKG, that is going to indicate like a peaked P wave. And sometimes in a V1 lead, you might have like a large V wave and also indicating a right bundle branch block. And we mentioned the whole echo, how that you look at the tricuspid valve and you can see the velocity because you're just measuring the backup of fluid from that pulmonary artery and the right ventricle. And between that is that regurg that could be happening from too much pressures.
Yeah, if you get a chance, I would definitely recommend just taking a look at how the echo looks because they literally put this little thing on the left side of your chest and it visualizes the heart and the pressures in like a current time basis. So when you look at the screen of the echo, you see different colors, and those signify the pressures and the blood moving throughout the heart. It looks really cool because it's like a live action, like a CT scan. You have just the image itself, but on an echo, you have a moving heart and a pulsating heart, and it actually looks really cool. And you can see the pressures.
So the first time I saw one was with my dad when he got rushed to the ER. But side note,
if you want to watch or listen to our latest episode,
you can check us out on Apple, Spotify, or watch us on YouTube.